If you have been stretching your sciatic nerve to try to eliminate your sciatica and you're wondering why your pain is not going away, then today's video is for you, because we are going to discuss today why stretching your sciatic nerve does not work, why stretching your hamstrings may actually be aggravating your sciatic nerve, and we're going to discuss at the end flossing. A lot of people do neural flossing because they've been told that that's good for the sciatic nerve, so we're going to discuss if you should be doing neural flossing instead of stretching. As a specialist physical therapist, I get asked this question all the time. And the truth is that when I'm in the clinic and I actually get to talk to people, I can use more specific terms based on what I know about their body. So I've done the evaluation, I know where their sciatic nerve is getting stuck, and I can explain specifically to them why the sciatic nerve stretching is not good for them. Now, the truth is with you, my friends on YouTube, I don't know specifically why your sciatic nerve is stuck or why you're having sciatica symptoms. However, what I do know is that the sciatic nerve does not like being stretched, and it often does not like being flossed. And I get a lot of comments on YouTube about people saying you're confusing us because you're saying something different than everybody else. And my intention is not to confuse you as I'm saying these things during videos. My intention is to help educate you about things that may be aggravating your sciatic nerve. That's why I wanted to take a moment today to explain to you why the sciatic nerve does not like being stretched, although I cannot explain why so many people recommend the stretching or the flossing. The one thing I can say is that I went to PT school a long time ago, and one of the treatments I was taught for sciatica was to stretch the sciatic nerve. Well, that went out of vogue as we learned that the sciatic nerve actually doesn't like to be stretched because of its structure, which we'll discuss in just a minute. Then it turned into neural flossing, and that was a thing that everybody was supposed to teach their patients to help with sciatica. However, even when I implemented the neural flossing with my patients, they didn't necessarily get better over the long term. And I admit this is what I was teaching my patients because this was the best practice at the time. This is what I was learning from people who knew better than me. But I was wrong at the time. And after 25 years of clinical experience, as well as getting my PhD in orthopedic manual physical therapy, I finally figured out why. The sciatic nerve does not like being stretched because of its structure. You see, the nerve itself does not like tension. Irritates the nerve, it increases inflammation around the nerve, and it may actually cause some damage to the nerve. The sciatic nerve is the biggest nerve in the body, but it's important to understand that nerves do not tolerate tensile forces. There are other areas in our body that do. In fact, if you're trying to heal a tendon, it actually needs that tensile force in order to stimulate healing. That can also work for muscles as well. It just doesn't work for nerves. The nerves get irritated under tension and may actually increase your symptoms over time. Now, you may be saying to yourself, but Dr. Amy, after I stretch my sciatic nerve, it feels better for a while. And I can admit that that can be true, because what's happened is when you stretch the sciatic nerve, it's changed the signals that are going to your brain. So the signals in your brain say, hey, there's been a change, there's something different. And they may actually shut down that response that says, hey, this is a painful area, while it's considering what's going on. However, what I have noticed with my patients clinically is that they will then have increased pain or a flare-up of their symptoms a few hours later, which is super hard because you feel like I stretched my sciatic nerve and it felt better, and then I had this flare-up a couple hours later, I should go stretch my sciatic nerve again. And it works in the short term. It actually decreases your symptoms in the short term. However, then you have a flare-up again. And then you're stuck in this vicious downward spiral of stretching and aggravating the sciatic nerve. And this may be why your sciatic nerve is not healing. So if this is you, where you're saying, this lady is crazy, then I'm just gonna ask you to try something and see if it works for you. Try not stretching your sciatic nerve for 1 week and see what happens to your sciatic symptoms. Because the truth of the matter is, I understand it doesn't matter what I say, it really matters what your body says. So what should you be doing instead of sciatic nerve stretching while you're dealing with sciatica? I'm going to link some exercises and some recommendations that I have. We do have an entire sciatica playlist. In those videos, we'll discuss exercises and stretches and different things that you can do to help eliminate your sciatica. You may be saying to yourself, well, I don't stretch the sciatic nerve, I stretch the hamstrings, and I feel better after I stretch my hamstrings, but then my sciatica flares up a couple hours later. Well, the thing is, when you're stretching your hamstrings, you are actually stretching your sciatic nerve. Because your sciatic nerve runs right through those hamstrings and along that same path, anytime you're stretching your hamstrings, you're also going to be inadvertently stretching the sciatic nerve. Now, the hamstrings do like to be stretched. Muscles like to be stretched, and it does help to decrease tension in the short term. However, when you stretch the hamstrings and you're also stretching the sciatic nerve, you feel better in the hamstrings for a period of time because muscles like stretching. However, you've aggravated the sciatic nerve, and so when it rebounds, it's actually going to increase your pain and increase your hamstring tension because the sciatic nerve innervates or goes through the hamstrings or provides the nerve input to the hamstrings. So when the sciatic nerve is irritated, it makes your hamstrings tight, along with the other muscles that it innervates as well. So a lot of people will stretch their hamstrings because they feel tight and they're having this pain that's going down their leg, and they feel good initially, but in the long term, it actually propels them into this cycle where they continue stretching their hamstrings and their pain increases a couple hours later. So friends, please hear me. I understand that after you stretch your hamstrings or after you stretch your sciatic nerve, it may not hurt right away. In fact, it may feel better. However, it's getting you into this vicious loop that is going to increase your pain and keep your sciatica symptoms going for longer than they need to. I have seen it time and time again clinically with my patients, again, many years ago, because I don't have my sciatic patients do sciatic nerve stretching or hamstring stretching when things are really flared up. So I don't have any recent stories of any of this, but I am really familiar with that pattern. Now, the next question you may be having is, okay, well, I don't stretch my hamstrings, I don't stretch my sciatic nerve. How about neural flossing? So the idea with neural flossing is that all the nerves in the body are connected. So you've got your brain, you've got the spinal cord that's going through the vertebrae, and then you have all the nerves that are going out to your arms and legs. And they truly are all connected. The thought with neural flossing for the sciatic nerve is that the sciatic nerve is getting tethered down. And so what you want to do is floss it, just like you would floss your teeth, go back and forth to try to get it to loosen up or break free from any adhesions. Now, that I have found to be very effective, but not when you have a really hot sciatica type symptom. So when you've got the shooting pain, the burning pain, the zinging pain going down the back of your leg, and it's really aggravating, neural flossing will again make it more aggravated. The reason why is when the sciatic nerve is in that state, it is inflamed, it is irritated, it's being bathed in this soup of inflammation around it. And when you floss it, it's basically like exposing more of the nerve to the inflammation. So it actually increases the inflammation, exposes the nerve to more of the inflammation, and things don't end up going the way you had planned. Again, I understand that when you do the neural flossing initially, it feels better and it feels like, oh, I feel like I can move a little bit better. However, it will be later on that you'll notice that flare up of your symptoms. Which leads to the next question of, is neural flossing ever good? Now, I actually do like neural flossing when you have what I call a phantom sciatica pain. So I made an entire video about this and we'll link it below. However, a phantom sciatica pain is when you have pain down the back of your leg that travels along the sciatic nerve path, but it's more like a tension or an ache. So the sciatic nerve is saying, hey, I'm a little bit irritated, but I'm not super inflamed. I'm not giving you the classic sciatica symptoms of burning, zinging pain, and potentially numbness and tingling. So if you have what I have termed phantom sciatica pain, then neural flossing can actually be really helpful, because chances are good with phantom sciatica pain that what you have is a sciatic nerve that is actually trapped in the fascia somewhere as it travels from your low back down through your hip and down the back of your leg. If you're someone who's had sciatica pain in the past, or if you have a history of having sciatica pain episodes, chances are good that it has gotten adhered down somewhere along the path. So when you have that achy pain, or you just feel like your hamstrings are really tight, but you don't have any sharp shooting pain, you're not in that really acute flared up phase, this is the time that neural flossing can be super, super helpful. And here's the thing that you can watch out for. If you think that neural flossing is going to be helpful because you have more of that tension, that deep achy pain, then try the neural flossing one morning and see how you do for the next 24 hours. If the neural flossing decreases your pain initially, but also helps to keep decreased pain throughout the day and decreased tension in the hamstrings, and number 3, making sure that you can actually sleep through the night without that achy pain, then yes, I would say that that neural flossing is helping you. You've tested it out over a 24-hour period of time, and that would be safe for you to do at that point. I hope you can understand from this video that sciatica and the symptoms of it are different for everybody. The causes, the root cause of sciatica can be different for everybody, as well as how long they've suffered. Because if you've suffered for a long period of time, you're going to end up having more issues. You may have some scar tissue that has formed around that nerve. You may have changed your biomechanics or how you're moving in the world, which may actually be causing more damage to your sciatic nerve. And it's really difficult to tell from this far away. We do create a ton of content to try to help you with all of these different variations, so please feel free to check out the sciatica playlist. But our hope today is that we were able to explain why you should never be stretching your sciatic nerve and why you should only be flossing your sciatic nerve when it's not so irritated. But I would love to hear your questions below. So if there's anything that you're confused about with this video, please drop a comment below, because I'd love to make another video to answer your specific questions.